Hello, and welcome to today's lecture in the Policy and the Pandemic series, PA Officials, Local Response to COVID-19. I'm Whitney Sheridan, Director of Communications for the School of Public Policy in the College of the Liberal Arts at Penn State. While most decisions about Pennsylvania's response to the coronavirus has been developed at the state level, our local officials have assumed the role in executing the orders. A new report, How Pennsylvania's Municipalities and Local Officials Confront the Coronavirus, tells us how our elected officials across the Commonwealth have faced the increased demands and new challenges. It also provides policy recommendations. We'll talk to one of the investigators of the study in just a moment, and we'll invite your questions. But first, I want to set a few ground rules for our conversation and let you know about some additional events that we'll be hosting as part of this series. We encourage your participation today and invite you to type your questions in the Q&A box at any time throughout the discussion. I want to remind you that your registration for today's webinar includes attendance for any or all of the events in our Policy and the Pandemic series. We hope you'll join us next week at this time when Simon Hayter, Assistant Professor of Public Policy, will discuss Health Policy Scholars' assessment of the U.S. COVID-19 response. And now I'm delighted to introduce Selena Ortiz, one of the investigators of the report, How Pennsylvania's Municipalities and Local Officials Confront the Coronavirus. Selena is an Assistant Professor of Health Policy Administration and Demography. She's also a faculty affiliate of the Center for Healthcare and Policy Research, the Population Research Institute, the Rock Ethics Institute, and the School of Public Policy at Penn State. Selena, thanks so much for being here with us.
Thank you for having me.
Before I ask my first question, I want to note that we posted the link to the study on our website, publicpolicy.psu.edu, and on the presentation slide that you're seeing here that we're going to remove in a few minutes, and I'll add it in the chat here as well. Selena, first I want to ask you about the motivation behind this project.
Thank you, and I just want to start off by thanking my colleagues, Gary Adler and Eric Plutzer, for their collaboration. It's been a great project to do with them, and I don't think that this project could have come together without different disciplines coming together to look at these issues. So my colleagues' works in examining local municipalities, coupled with my background in public health and health policy, led to conversations about the strength of the public health infrastructure and local government preparedness to effectively address COVID-19. And so what we know from other studies is that the policy response to public health crises can vary widely across local municipalities despite state policy efforts. And I think, we may get to this issue, but thinking about the multiple local government types in Pennsylvania, and because there's only 6 of 67 counties which have a public health department, we became really interested in how Pennsylvania local officials were addressing COVID-19, how they were responding to state efforts, and what their needs were to continue to effectively confront the pandemic, among other things.
So you mentioned 6 of 67 counties in Pennsylvania have public health departments in your report. How does Pennsylvania measure up compared to other states?
A study that was done a decade ago suggested that Pennsylvania has the lowest per capita number of public health workers. And this actually plays into this, the fact that in Pennsylvania, when we think about the number of contact tracers that are available, we also know how many are going to be needed to do that. So in the last decade, some counties have also resisted calls to begin public health departments. If you look back to an issue in Delaware County with 500,000 people near Philadelphia, it only decided just after the last election to create their own public health department. Unfortunately, however, it wasn't in time for this pandemic. So I think we could see the fruits of that, the results of that, the consequences of that, perhaps more appropriately, as this pandemic endures and persists.
Speaking of contact tracing, Governor Wolf and Health Secretary Rachel Levine have repeatedly stated that strong contact tracing system, the ability to locate infected individuals, identify close contacts, and ask those contacts to quarantine are critical prerequisites to reopening.
Mhm.
But as you mentioned, we don't have a full and consistent contact tracing system in place. You know, what do you recommend to help increase these efforts, and what do we need to prevent a major resurgence?
Yeah, so that's a really good question. I think that we should look to other states as well in regard to what they've been doing and their efforts in contact tracing. And I know that we're going to talk about communication, but I do think that communication is a really important issue in regard to increasing efforts and making them effective in regard to contact tracing. And so to gain the public's trust, there have been some studies that have looked at how officials should be working directly with community members when they develop contact tracing programs. And that's really important for vulnerable populations, at-risk populations, elderly communities, rural populations, certainly for low-income communities and communities of color, which may be suspicious of the healthcare system in general, even as they're facing high rates of coronavirus infection. Right, so there's an interesting study that was done in Massachusetts where they found that even using the word agent in having contact tracers introduce themselves to folks that they were contacting was a trigger for residents to not positively respond. Right, so it's really important that contact tracing programs have input from local officials, from local communities, so that it's scrutinized, and to make sure that we don't exacerbate worries, that we don't exacerbate suspicions around who's calling, why are they calling, what's going to be done with my information, and so on.
Let's talk about communication, since that's something I did want to talk about. This was one of the major concerns that in your findings, and one of your recommendations, one of your policy recommendations was to improve communications. Let's talk a little bit about that. And what were some of the tools that you recommended, and what were some of the concerns that our local officials had?
So I think that there could be you could look at this two ways. One is that we found that more direct communication with the state was really desired by local officials. There were communications with their county EMA, which a lot of local officials said was very helpful, but that direct communication was really needed. And on the other hand, we also found that there was a lot of information being sent to local officials in ways that local officials reported were really difficult to sort through, really difficult to understand, difficult to apply to their communities, and what were the next steps, because so much information was coming at the same time. And I know for those of you who are on the call who had to switch to online teaching, I sort of likened it to that. For those of us who have never done online teaching, we were presented with a barrage of information of how to do online teaching well, and where to turn, what to use. That was quite confusing for many of us, right? Good intention, but overwhelming. And I think that's where local officials also feel that if they had a seat at the table, if they were able to communicate with the state, they would be able to better communicate how and what type of information, how best to transmit or translate that information, how best to apply that information, and more importantly, what to do with it going forward.
Was there some criticism of the state plan that many decisions should have been left to the local level? Because a lot of it, came down from the state and then it was executed at the local level. But was there some criticism that a lot of it should have just been left up to the local governments?
I don't think that we saw that in our results. It wasn't as explicitly stated as such. There wasn't, the state doesn't know and we know best. So okay. I really do feel that any sort of resistance or concerns around what they felt was lack of local coordination had more to do with wanting to work with the state. Now, you know, with that said, there were tools or things that a municipality could have done to help sort of run things on their own. So like one of the things we found were emergency declarations and what municipalities declared it, right? So we found a large percentage of municipalities had declared an emergency declaration. And those things are really important because it helps to allow municipalities to actually conduct a wide range of actions in regard to conducting their own business affairs. I'll get to that later, but the state's guidance on public health decisions is final. And I don't think that any local officials were resistant to that. It's not what we found. Now, those counties and municipalities with health departments, which have more resources, structures, and leeway to act, you know, that presents a different case. But as we started talking about earlier, if only 6 out of 67 counties have public health departments, then we're looking at municipalities where they rely on this direct communication with the state. Yeah, so I have a lot to say on
I know.
That, yeah, go ahead.
Reading this report, you know, a lot of it I felt like I wasn't surprised by some of the responses, but then one of the things that I was surprised about was that everyone seemed to be pretty much consistent with how they felt about reopening. Can you talk a little bit about that?
So I think this also speaks to the larger conversation that's happening in the country is, you know, who is open to wearing masks, who is open to being socially distant from one another, who is open to reopening or not. And again, you know, that was a surprising finding from us as well, because even though there were concerns around business failures and unemployment, local officials really do wanted to reopen in a way that was careful, that took into consideration where the virus was, like where we were at in regard to the pandemic, and felt that there were things that could have opened later. So schools, even houses of worship, bars and restaurants. Now, of course, we saw some significant variation depending on whether it was cities or first-class townships versus second-class townships or boroughs in their response. But overall, we found that there was a lot of consideration and understanding about where the public's health was at that point in time. So, you know, I think it'd be really easy to sort of think, well, there are going to be some municipalities that we know because of where they're at or because of political affiliation or whatnot that may have certain feelings and sentiments towards reopening. But we didn't find that necessarily. And I think it's important to emphasize sort of the common concern that Pennsylvanians have about this pandemic. And we don't hear enough of sort of the commonalities, common shared concerns that we have.
Did you find, was anything else surprising about the results that you found?
I think one of the other things that we found surprising, and it's related to the reopening, was that the personal behaviors of local officials themselves in wearing masks when they went outside their home, in staying 6 feet apart from others, that a large majority of of local officials reported doing those things.
Hmm.
Now, when you look at results in regard to their perceptions about whether residents in their communities were also doing those things, that's where you see sort of the gap, where you see
Hmm.
local officials behaving in this way and their perceptions that their residents aren't. And so this is why, again, one of our recommendations, and as I've thought more about this, is why it's so important to give these communities, to give local officials a platform in which to talk about the pandemic and how it affects them personally and how it could impact, if it's not already impacting their residents, to sort of bridge that divide that you may see. And local officials can serve as really effective role models for their residents, particularly if there's any, again, going back to this trust issue, if there's any distrust among their residents towards official public health or state public health officials. So that was surprising to us.
We're speaking with Selena Ortiz, one of the investigators on a recent report, How Pennsylvania's Municipalities and Local Officials Confront the Coronavirus. I want to encourage you to type your questions in the Q&A box, and we would be happy to address them at any point during this discussion. Selena, we do have a question already. This one comes in and says, the question is, do you see any correlation between local health department officials' personal behavior and the rates of COVID in their counties? Is that something that you looked into in this report, or something that you might have been studying?
I mean, it's not clear. So it's an excellent question, and it certainly is something that warrants further empirical investigation, and something that we are gathering contextual data right now for all the zip codes in Pennsylvania so that we can actually assess those things. I mean, certainly I think that in another study that I'm working on, certainly I think that there's perceptions about the disease itself and whether it's going to impact them. There's a disconnect between whether they view it as being an issue and case rates, right? Where you see high case rates, but people are saying, oh, it's not an issue in our community. And actually that reminds me of a point that I really wanted to make clear, is that we found that a majority of local officials stated that they did not believe that the coronavirus, and this was around 57%, did not feel that coronavirus was not likely to become a serious problem. So that, and I think that was shocking.
That is shocking.
It is, especially when you look across the US and you look at rural communities and populations. And I think even more so, again, this is why these results are important, so that we help sort of raise the communication, expand communication with local officials, and present data and share data with them in a way that helps understand where this pandemic is going, and not if, but when.
And you also have some questions about plans for the future as well that I want to get to in just a second. But following up on that viewer's question, Pennsylvania has been using the Disease Control and Prevention Act of 1955, prohibiting the release of disease records by state or local authorities, except when necessary to control the spread of disease in a community. And while this is important about, privacy for individuals, for patients, how do you suggest we balance the public's need for information with the patient's need for privacy? So there are those issues, but it's also important for people like you who are studying this to make sure we have the accurate data for our demographers and our epidemiologists, so that we can track this information. It's important for contact tracing as well. All of this is, where does something like this Disease Control and Prevention Act, which is from 1955, how does this play into this current pandemic and what we need to, what do we need to do with something like this? And,
Yeah, I mean, so you ask an age-old question, I think
Mhm.
that those of us in public health have grappled with for a very long time. How do you sustain the health of the community, but also recognize and respect the individual and their need for privacy? And so I think that is, I think that's the critical question and something that we should continue to study. But in relation to into local municipalities and the data that they do have, you know, what we are finding is that because of this Disease Control and Prevention Act of 1955 that you mentioned, it now then shifts to who has access to data and who doesn't have access to data.
Mm-hmm.
So that the fundamental question of how do we balance need for information with a patient's need for privacy is there. But on top of that now, it's, well, some people or some groups get access to this data and others don't. So if you have a local public health department, that public health department itself can decide how to use that data and how to use that data or coordinate with others about its use. If you do not, then you're relying on the state, and the state is prohibited to release those records, right? So you've got some who have access to this data and others who don't. So the other thing to think about is that even those counties that do have public health departments in them, they haven't necessarily used that data all in the same way, right? So there's inconsistency there as well. Even though there's consistent, they have access to the data, there's inconsistency around what can be used with that data or how that data is released or known. And again, just going back to my earlier point, is that the large majority of counties in Pennsylvania don't have any choice. So it might be that more localized data, if you think about, well, what are the repercussions or the consequences of local areas not having access to their data, is that it may help to, or maybe having the data would help to build rural urgency around this issue, right? So you have to think about, what do we lose by not having these communities be able to access their data, and what do we gain, or what might we gain?
We have several questions, and I do want to get back to that point about rural communities, because that's really important as well. One of your policy recommendations was providing accessible and relevant data, so that was really important part of your report. You had several policy recommendations, and I encourage people to go look at the report. We put the link in the chat here in Zoom. It's also on our website as well. But I want to get to some of these great questions that we have here. Catherine Baumgardner asked, what role might public health and policy support the university as students return to campus? There will of course be the health of the university community as well as the health of the surrounding community at large. What approaches have worked to balance the public health issue versus civil liberties? So that goes back to that balancing.
I mean, I anticipated that these questions might arise. I mean, if you look at you know, Penn State as a town, the university itself, right? It's I think those same considerations are there for a university as they are for the local community. So because a university controls itself, right? It's not necessarily beholden to other policies. I think Penn State has the opportunity to maybe set the example for how do you bring folks back, how do you, and I want to tie this into a finding that was, I think, really important, is that local officials didn't feel empowered to enforce state orders regarding stay at home or shelter in place or business closures. They didn't quite know what their role was. What power did they have? Could they enforce? If they enforced, what did enforcement look like? And I know in speaking with my colleagues right now about Penn State opening up, there are a lot of questions around that. You know, what is our power in sort of enforcing either our colleagues or our students or staff or whatnot, what power do we all have together to make sure that we're all sort of living up to these expectations? But if you think, so that's one thing. I mean, we could have just a session just on that, right? But then you think about sort of the health system here in State College. And, you know, if you think about some of the things that we found in looking at our qualitative data, were folks saying, look, even if we had a very small increase of the number of cases, that could really tip the scales in regard to being able to respond in a way that was effective and appropriate. And so there's concern about the hospitals being able to care for patients. I don't know if we're in that, if those same considerations should be happening for us in thinking about Penn State opening. Where are we at when we think about bringing 50,000 people back into State College and the county for not just care if needed, but also contact tracing, also for quarantining, and then again, going back to the personal behavior. It's an excellent question, and it's something that I, you know, really trying to loop back into what we're hearing from our local officials. But I would encourage all of us to participate in that in the town hall coming up.
Definitely, and that issue of who has that power to make these decisions is one that I know our local governments, you know, who's running the show and who gets to make these decisions is one that I wanted to talk to you a little bit about. We have nearly 5,000 governments at the county, municipal, and special district levels in Pennsylvania, and who has the power to make binding decisions throughout a crisis like this? Do our local governments have to seek permission from the state legislator before making new regulations? One of the things that you found in this report was that a lot of these local governments have to seek help from nearby municipalities at different points. You know, a lot of times they're stuck if you know, I think there were some comments saying, you know, if they're in lockdown and they can't have meetings over Zoom because they have to ask permission if they're allowed to have meetings that way. How do we solve these issues? What were some of your recommendations?
Yeah, it strikes me as I read the results from this report again and again, and as we continue to learn more from our data, you know, it strikes me as though we shouldn't think of this as sort of a retrospective, you know, this is, what was done in the past, or this is a case study of what happened in Pennsylvania during this one time. I think it's become very clear that this is an issue that is going to stay with us for a very long time. And so these questions that you raised and that we're talking about today are going to be germane for a very long time. And so, you know, if a municipality, so say for example, we talked about these tools that municipalities had, declaring an emergency, right? So they can do a wide range of actions to assist their local area. They can, some of them are, they can accept contracts without sort of the bidding that normally would occur. And they could also conduct some business functions without adhering to the normal processes. But we found in our open-ended responses that there was a lot of confusion around that. Like they just did not know how to go about conducting the important daily functions of their office. And I do need to stress that when we say local municipalities, right, we're talking about 4 different classes here in Pennsylvania. So we're talking about cities, we're talking about first-class townships, second-class townships, and boroughs. And even within those classes of municipalities, there are differences. There are some smaller municipalities that literally only have 1 staff or 1 personnel member, others that are bigger. and the compositions are very different as well. So again, going back to this point of those with health departments, they seem to have more resources, structures, and leeway to act. But to run the show well, you need all levels of government to be involved. For example, it's local police departments for many places that are really key, right? And others have state highway patrol for others. That was tasked with enforcing the state's orders. And now, particularly in this time, is that the best?
Those are the questions
entity?
we're asking.
Right.
They're being tasked with more and more of these other different tasks that they're not usually tasked with, that they're not specializing in.
That they're not specialized in, that they're not usually tasked in, and
not trained in a lot of the times.
And are they the appropriate entity? Right. First and foremost.
Right.
And
we have a question here actually that I want to point to that plays off of this. This is from Andy Fenelon, one of our faculty members. He wants to ask a question linking two major current events. Do you think racism limits the preparedness of local health departments? Meaning, are white people in diverse areas reluctant to invest in public health departments because they perceive that it will benefit people of color? So Andy's just jumping on in it.
No, it is something. So we asked a
question.
It's absolutely critical, and it's something that cannot be glossed over. So these are the sorts of things. This is why gathering and linking the contextual data with our findings is really key. I mean, I mentioned earlier in Delaware County, which is one of the largest counties in Pennsylvania. And they're experiencing a significant surge in COVID-19 cases, right? So they had the opportunity to create their own county public health department, and it didn't get done until recently, and when it was not in time, right, to address this. We asked a question about local officials' concerns around racial ethnic minorities and uncivil behavior towards racial ethnic minorities. We didn't see much concern around that. Now, that could be, I want to just make clear that could just be associated with the number of racial ethnic minorities or percentage of racial ethnic minorities in that particular municipality. But it's something, again, that we need to examine. There are some things, and I think all three of us are, certainly myself, I won't speak for Gary and Eric, but I know for myself, getting to the point where you think about which policy domains need to be consistent across all levels, things that should not vary. And I believe that public health preparedness, emergency preparedness, having a pandemic plan in place, those things should not vary at all. Like the same amount of investments and buy-in should occur, and when I say vary, across political domain. And I think that is absolutely crucial. And it's hard to talk about, but we need to talk about it when everything from mask wearing is becoming politically weaponized. Right? So actually even doing things that keep you and others safe are being used to identify oneself as, it's all partisan play, that deadly plane that really should have no air to breathe in this situation.
We have a couple questions I want to get to, but I want to follow up on that point. Out of your report, did you hear from local officials that following what they experienced dealing with this pandemic, do they feel as if they're more prepared should we have a resurgence, given their experience? Have they become more prepared? Do they have plans in place?
So,
Have they put anything in place?
yeah, I mean, so going back to this point that we were just talking
Mhm.
about, you know, we saw where less than half,
Mhm.
just over half of
Mhm.
municipalities, excuse me, had either an emergency response plan in place or relied on other neighboring
Right.
municipalities, which shows how many more, right? So just under half
Mhm.
didn't. Um, and so it's just, you know, it's all reaction. It's no proaction, it's all reaction. Um,
But are they creating some in this sort of time where we're opening up in case something happens?
Well, so I think this is where the investment comes into play, and what resources are available for municipalities to actually get things in place. Um, and so this is where I want to get back to that, but I want to mention the CARES Act, for example.
Mhm.
So the CARES Act, they have the Coronavirus Relief Fund, which was established by the CARES Act, and there was around $150 billion that could be used by certain local governments. So they could cover costs that are necessary, expenditures incurred due to the coronavirus public health emergency. But there's limits here, right? It was only directly available to municipalities with populations greater than 500,000. And so there have been some organizations, the United States Conference of Mayors, have advocated to get this threshold down to 50,000 population. But even here in Pennsylvania, that's not low
Mhm.
enough, right? So even smaller municipalities should be eligible for funding. There are some municipal associations that are helping communicate and organize. I actually had, you know, I anticipated that maybe one of the questions would be, who are we communicating with to spread the word around around our findings? And so we've actually had some great conversations with some local governments and government associations in regard to our findings and how, you know, some things that they're doing. Beaver County, for example, has a
Mhm.
hub, a data hub available on COVID-19. So there's a
Mhm.
lot of folks that are trying to band together, work together to address this issue. Um, Clearly, in the absence of a unified national response, I
Mhm.
think the state has done, the state is doing what it's doing, right? And there's a great portal that
Mhm.
is available. And I think that's very good. I think that their efforts, Pennsylvania's efforts, have been good. And again, that is heard and accepted and repeated by local officials. A large majority feel that the response has been good. But the same amount also say that coordination and communication could be better. And
Mhm.
so how do we have a unifying response across local municipalities, you know, that is the same, that is, so that you don't have these disparate acts of coordination and which leave gaps in care. So it's something that I've been thinking quite a bit about, how to move forward.
Right. I noticed some of your recommendations, including things like local officials need templates to develop plans,
Mhm.
and you just mentioned create opportunities to directly engage with communities,
Right.
you know, with local officials, which is great. That's something that you're doing, and having the local officials engage with their communities to help keep them updated on what's
Mhm.
happening.
Mhm.
Um, but these templates and things like that, that's going to be further down the road, of course.
Mhm.
And who
Yeah.
develops that?
Yeah, and who develops that? And so
Right.
I mentioned a statistic. I said
Mhm.
that um, you know, either they had 50% around, a slight majority had pandemic plans, or they had these relationships with
Mhm.
other municipalities. But even among those, and looking at the open-ended question of what do you need to be more prepared, a lot of
Mhm.
local officials and municipalities said, it's great that we have these relationships, but we cannot apply these plans that we're borrowing from our neighboring municipality because they just don't fit us. They're just not appropriate for
Mhm.
us and what our capacity is, right?
Mhm.
So we have just less than 50% that don't have anything.
Mhm.
And then even among those that do have these agreements with neighboring municipalities, even those plans aren't appropriate.
Mhm. Exactly. We have a couple questions I don't want to miss. We have a couple folks asked about aging and nursing homes. So I want to get to those because, you know, that's something that's been important. It's been in the news a lot. We had someone ask, nursing homes and prisons have been hot spots, but local officials have limited powers to control these institutions that are more regulated by the state. Did local officials address any of these issues?
In asking about which populations were they concerned with, certainly the elderly
Mm-hmm.
was at the top.
Mm.
And there was a lot of discussion in the open-ended response uh, around not being prepared. I mean, that we even saw things around PPE.
Mm.
Um, we saw things around just data specific to nursing homes. And
Mm.
so when you look at like, what do local officials want? What do municipalities need? And this issue of access to data,
Mm.
specifically around nursing homes, did come up. So they wanted to know, and again, we're going back to, for the most part, those
Mm.
municipalities that did not have a county health department. They want to know, were there outbreaks, were there cases in our local nursing homes?
Mm.
They don't have that information. They can't access that information.
Mm-hmm.
And so, you know, I think this feeling of that they're in the dark and they don't know what's happening, they don't know how to access it, and as the the questionnaire had, yeah, they're governed by a whole other set of rules. How do those align? How do they butt up against? Um, those are all really important issues to resolve.
And we had one person asked a couple different questions here. I'm going to kind of combine this. How did local officials respond to isolated older adults, and did you see any issues of ageism emerge?
No, we were very considerate of looking at the age also of the respondent.
Mm.
And so one of the things that we, you know, I go back to this issue of how concerned they were. And so
Mm.
older local officials were more concerned about the coronavirus than younger, but even I think it was around 27% or so. And I apologize if that statistic isn't quite right, but it wasn't as high as we expected. So that's in regard to themselves. In regard to their community, I did not see any of that. I only saw when the elderly or persons at risk were mentioned, it was more about concern that they don't know how they're faring. And I, I think in regard to accessing care, should those communities need services or medical attention, accessing those services in a timely manner.
One of the major concerns that you found, a local concern, is voting, and someone asked a question about that. I was going to ask some as well, but I'm going to go with this one. Your
Yeah.
survey shows that over 40% of officials are very or extremely concerned about voting problems in
Mm-hmm.
the next 6 months. Were you able to unpack that concern any further? What are they doing to prepare for the federal election?
It's a great question. And no, we weren't able to unpack that.
Mm-hmm.
And it is an area of investigation that we are going to look into. And certainly when you think about the percent increase in those of us who are voting through mail,
Mm-hmm.
you see that that is a real issue for voters, and it should be a real issue for local officials. And we were very pleased to see that concern. And so again, it speaks to, we had thought about asking about coordinating with local county voter registrar and those things, but we only had so much space in the survey to ask those sorts of questions. So it's something we haven't unpacked yet. It's something that we will. It's something that we will link this data to other data, voting data, and look to see what sorts of associations there are with COVID-19 and all other sorts of things. So I think if we could have unpacked that, that would have been my one area that I wish we had explored further, but we had to make some hard decisions.
Here's a really interesting question about the respondents and the people that you surveyed. Did you see much difference between elected officials versus appointed local officials?
Oh, that's a great question. We have not broken that down just yet. But that is an excellent question. And I would love to speak with the person who asked that question about some of their thoughts on what we might expect to see. Now, I will also say relatedly that we had not looked at these results by political affiliation. And I think for the report, that was very important for us because we did not want the results from this report to be fall in the, oh, well, these results are based on, you know, what your political affiliation is. Now, we will empirically investigate that, but from our open-ended responses, we see that there were concerns around coordination and communication from Democrats, as there were Republicans, as there were independents, right? So how do we not make this a political story? We will see, you know, we will do the analysis to investigate that. We do know that about a fifth of our sample was non-elected. So hopefully we have enough power there to be able to see if there's any differences in these responses by that issue.
So I was going to end with asking you, what are the follow-ups for continuing this report, but I'll ask it now since we're talking about it.
So we are going to be examining the voting issue and either using this data as a way to explore with national data around concerns around voting and whether those concerns actually do translate to action in regard to vote by mail, same day registration, those sorts of things. And so I'm really looking forward to that. And I think we should just also think about, and we actually are, how do we make this not a story about political affiliation, but how do we make this a story about preparedness, right? So I talked earlier about there are just some domains that should not be politicized, and that is emergency preparedness and public health. It should just not be, especially in times like these. And so the easier story to tell, and maybe the more, the headline story out there is Republicans think that way, and Democrats think that way, and that's what leads us to how different areas respond. But I think doing that makes us miss or overlook really important structural, contextual issues that can make a difference. Sort of, again, investing in pandemic plans or emergency response plans or having people at the table. So what are the structural components that we can invest in that make everyone feel that they've got a seat at the table, that they all can contribute their ideas and have these conversations so that the responses to state orders, because we'll see this again, right? We're going to see state orders at some point in time. But if people are able to gather around the table and be better prepared, then we think that that may have something to do with how they respond.
So we have a question here about Penn State, and I think maybe we can kind of link that to how our local officials felt about the state orders with regards to places of worship and schools and the closing of businesses. But they want to know how local officials are supporting this reopening decision at Penn State. Are local officials supporting this decision, the reopening? If not, can they intervene since it puts the entire community at risk? So if you want to reiterate what you found as far as the consensus.
Right. Again, so recognizing the importance of, look, I think we'd all love to reopen, right? I'd love to be able to walk into my classroom and walk into my office and, speak with my colleagues. All of us want to do that. I want to take my first grader to school. I want to take him to camp right now. But I think that we're all thinking, how do we do this in a safe way, in a way that allows us to actually get to normal, right? And even though we're concerned about business failures and unemployment and the effects of education or lack of education on children and childcare, and so all of those concerns. And so again, surprisingly, local officials, even though they want to open up, say, we want to open up, but we want to do so in a way that takes into consideration all of like safety and where the pandemic is. And so we're okay with opening up at a later time than we are sooner. And I just want to say, I know we didn't emphasize this, but the survey was actually conducted starting on May 1st to May 11th. So May 1st was the day that Governor Wolf first announced the reopening plan, right? So we didn't see any differences in these responses among those municipalities that were allowed to open sooner than later. So.
Well, one thing I wanted to ask you, you're talking about, concerns about reopening based on economic pressures and balancing that with safety. You did find that a large majority of the municipalities don't plan to raise taxes, increase fees, or furlough more employees in the next 6 months. Although they're extremely concerned about near-term unemployment and business failure. I was reading that 2020 is expected to be the most significant in Pennsylvania as far as revenue losses for cities, towns, and villages, with a shortfall representing 40.2% a loss of revenues. How can our local governments reconcile this and still be thinking that things are going to be okay in the long term without increasing these fees and without planning to raise taxes?
And I'm trying to remember if we actually did that assessment by
the time that came out.
Right. Well, no, what we did. And so, I mean, certainly the first thing I want to say is that it could very well be that we asked this question today and those responses.
And they would change their mind.
Are different. Exactly.
Sure.
And again, our responses varied by municipality class.
Sure.
With cities and first class townships more likely to consider each of these options. And of course, that makes a lot of sense since larger municipalities are going to incur a bigger hit economically. And so that's not surprising. But if you think about sort of solutions and how these can be addressed, right? So there's there's need for these roundtables, or there's need for communication and discussion and partnership. Advocacy is a really important issue. I mentioned earlier the CARES Act money, the Coronavirus Relief Fund. But again, those are only available for very large municipalities. How do we ensure that those funds are allocated towards smaller municipalities?
And I want to note in central Pennsylvania, we have a large number of very, very, very small towns with very, very low populated areas, towns with 1,500 people or less, a lot of those areas. Yeah. Right within the vicinity of State College here, so.
And yeah, I think that should certainly be part of the discussion. You think about the steps that were taken here at Penn State. You look at salaries or furloughing or, all of that has to be, it'd be one thing to think of us as sort of an isolated community, but we're not. Especially when you have faculty and staff and students coming from local areas that are going to struggle financially. We have to see ourselves as at Penn State as an active partner in those advocacy efforts as well.
Exactly. This report certainly has a lot covered in it. One of the things that's great about it are all of the policy recommendations. Do you anticipate more to come? Do you anticipate working? You said that you've been working with a lot of local governments already. Do you plan to continue that work throughout the summer?
Well, I certainly want to say that we've had people who were asked to fill out the survey. We had a lot of folks contact us and say, "Are you legitimate? Why do you want this information?" And many more people saying, "This is really great. We really want these things to be known. And and by the way, these are the things we're doing in our area. Could Penn State be a potential partner in helping us think through certain things?" Right. So there's all these anecdotal comments, we're collecting, and maybe one thing is, okay, this is what we found even after the fact, and this is how much local officials and municipalities want to be part of the discussion, and how do we help make that happen? I mean, certainly, I think for the three of us, this is the sort of public research that's so important. And I have been in direct communication with the Secretary of Health, who has communicated with me as well around this report. So it was really important for her and Secretary Levine and her staff to receive the report. They have a lot on their hands right now, right? So how much we can help sort of, again, things like this, I appreciate the opportunity to talk about it. I hope are helpful in generating the conversation. And I know that we're going to continue to explore our findings and think about how we can apply those findings to make some actual change in the area of policy.
Well, before we leave, I want to ask, are our local officials hopeful as we prepare to move into each new phase of reopening? And are you hopeful?
Oh, do we have another hour? Knowing what I know, I'm hearing this term personal responsibility a lot. And I've done work, one of my areas is framing and policy and communication and messaging. And, things that we've learned in other areas, say as obesity is one, it's much more than personal responsibility. It really is about the structure and trust and the institutions that help gain public trust. We have a lot of work ahead. I mean, that's for certain. But I do think that if there is any hope in regard to reopening, and I've heard this, with friends and family that I've had these discussions with, I think we can't be too hopeful, because to me, that's a sign that there's an underestimation of this disease, or it's underestimating the pandemic and how it can actually really affect us. And so hope is a good thing, but too much hope to me could be short-sighted.
Well, I want to thank everyone for their great questions. And of course, thank you to Selena Ortiz for being with us to discuss her recent research on how Pennsylvania's municipalities and local officials confront the coronavirus. We hope you'll join us this time next week when Simon Hayter will be here to talk about health policy scholars' assessment of the U.S. COVID-19 response. I'm Whitney Sheridan for all of us here with the School of Public Policy. Thanks so much for watching and have a
Thank
great
you.
day.
Thank you. Bye-bye.
Bye-bye.